Welcome to our presentation. My name is Rose Opiyo from the University of Nairobi, CARTA Cohort 1. My dream as a nutrition researcher is to see diet as the winning tool against disease in humanity. And my study today is on dietary prescription adherence among adults with chronic kidney disease on hemodialysis. Background to this study is based on the large numbers of people around the world currently suffering and dying from chronic kidney disease. The kidney disease occurs when the kidneys are damaged and cannot remove harmful substances from the blood, thus causing high blood pressure and infections. The treatment options available for these are dialysis to mechanically remove the waste products from the blood or transplant to replace the destroyed kidneys. Successful dialysis, however, requires strict adherence to the diet prescriptions to prevent overloading the kidneys. Yet globally, about half of patients do not follow their prescribed diets, and there are few studies from the African continent and none from Kenya. Now, following my dream of diet against diseases, we conducted a cross-sectional mixed method study in 2018-2019 to document the numbers and stories on adherence to diet prescription in Kenya. The participants were patients and their caregivers at the renal units and dialysis clinics, renal clinics and dialysis units at the National Referral Hospitals in Kenya. These were Kenyatta National Hospital and Moi Teaching and Referral Hospital. The findings were shared with the key stakeholders for validation and inputs. So what did we find? There was generally low adherence to dietary prescription at only 36.3%, just like in confirming what is there in other parts of the world. But looking at adherence to dietary prescription as a seesaw scale with the barriers and motivating factors on either side of the scale in Kenya, among the barriers that we found in this study were the fact that the diets were challenging to implement for most patients. There was also the cost of recommended fruits and vegetables that discouraged consumption of these food items. The cooking of meals separately was also found to be time-consuming and expensive. And there was also conflicting nutrition information where the diets were based on incorrect information. And there was also negative attitudes towards the new diets where the patients just did not like the new diets. However, on the other side of the scale, we see a few of the motivating factors, and one of these was the perceived health benefits of adhering to the prescribed diets. There was also fear of health complications in case of non-adherence to the diets prescribed. And there was also the fact that for some patients, diets were considered as flexible and not very restrictive. So what's the impact of this study so far? There are a few impacts, but we look forward for more. And among these is that the findings have been widely disseminated through workshops, conferences, and in journal publications. And this being the first study in Kenya on adherence to the diet prescription in patients with chronic kidney disease, the awareness on non-adherence to diet is high among clinicians and nutritionists who manage the chronic kidney disease patients. And there are also discussions ongoing with key stakeholders to develop local nutrition guidelines based on locally available and accessible foods in Kenya. And there are also discussions on development of patient-specific takeaway nutrition information material based again on locally available foods, and discussions on development of renal nutrition peer support with mentorship. We wish to thank all our funders who made it possible for us to conduct this study. Thank you.